So let's start with a very interesting case. And this patient is very difficult and a complex case. As I just mentioned to you, she was a case with all different possibilities. This is a recent case, just 3 years back. 35-year-old patient came to me in September. So I just before we start the case, let me just tell you one more thing. There's no magic wand. I've also made a mistake, and I want everybody to learn from the mistakes. It's okay to make mistakes, but when you give a result and you see the joy in the couple who conceived, that really, it's a joy beyond description. I've seen now those patients whose children are now 25, they are doing masters, and they are, one of them is in a medical school. It feels so much joy just looking at them, that homeopathy has helped these people conceive, and their life is fulfilled because the child is so grown up. So I just wanted to tell you before we start the case that I have not given a complete case. It becomes too dragging, and we don't have so much time. I wanted to share more cases with you, so I have shortened the cases. In some cases, there's a little just gist of the case, and wherever I've changed the medication, I've changed medication. I'm not saying that it's just one remedy that goes through and through and through. I've used nosodes, I've used sarcodes, and I've mentioned it in my cases. So it's just the gist of the cases. I'm not given a complete case. So this patient came to me in September 2019. Very difficult and a complicated case. And as I just mentioned to you, she had a septum in the uterus and a septoplasty was done. She had fibroid in the uterus. That also has been removed. I think all the 3 surgeries were done together. And she had an endometriotic cyst also in the right ovary. That was also surgically removed at that time. In spite of all that, she had 2 previous abortions, and she had 3 failed IVF procedures. Now, this patient is basically an Indian patient, and she is now in New Jersey, and she contacted me from New Jersey. Her serum prolactin level also was very high, 39, up to 20 to up to 25 could be a normal level. Now, this is also very interesting hormone. This hormone, if it is too high, it goes in 200 and it goes in 1000, then you have to look for a tumor, a prolactin secreting tumor in the brain. But just borderline high is seen in patients who are extremely stressed or who are depressed or who are on antidepressant drugs. Remember, all those drugs, nowadays, a lot of patients are on antidepressants, or young females or young males in 30s have hypertension. So many drugs have got interactions with the fertility. And her anti-Mullerian hormone, that's the one that I was discussing, where there's ovarian reserve is very low. This hormone also was very low. It was just 0.1, and the normal level is between 2 and 5, but her was just 0.1. That means the quality of ova is also not good, and the number of ovas are also diminished in her case. She's a very likely candidate that soon she may go into, not now, but after 10 years, she's just 32. By 42, by 45, she may go into premature menopause. Anyway, that's just the prediction. It may not come true. So before she came to the US, she had 3 frozen embryos, which were stored in a fertility clinic in Mumbai. She was planning to go back to Mumbai. She came to me in September, but she was saying that 6 months' time, if she doesn't conceive, by February, March, she would go back to India and get another IVF treatment done. And meanwhile, her old neighbor in India happened to be my patient, who said, "Why don't you try? The doctor is in US, in your own country, you can try homeopathy there." She started her treatment in September, and I was really surprised and that she conceived in 4 months. And she followed up throughout the pregnancy. Because she had aborted in the previous pregnancy, she didn't want to just give up homeopathy after conception. And I treated her with a constitutional homeopathic remedy till she delivered in October 2020. So what is about her case? I have written some points which are important for this case. When she came to me, her last menstrual period was in September. Menstrual cycle was very, very regular. Though her AMH was very low, she was getting 4 by 28, very absolutely a normal menstrual pattern. Flow was dark red to bright red to pinkish red. And at the end, she would get some occasional clots. She would have a lot of PMS symptoms, bloated feeling, gases. Another associated complaint was acidity. Acidity leading to headache, feeling depressed in the PMS phase, anxiety, and she used to feel like crying. So this is all very, very typical PMS symptom in certain sensitive females who are sensitive to the fluctuation of the hormones. And these are basically the effect of progesterone. Usually a very mild and emotional person gets attached very easily, gets hurt easily, needs to vent out, and then she moves on. Usually better by consolation, better by sympathy. You know now the drug. It's a very, very common drug. And I've always used a very, very well-proven homeopathic drugs. So you know now what is the symptoms coming up, what the drug coming up to. So better by consolation, better by sympathy, better by talking, better by crying, needs support from a husband and sister. Anxiety when things are not in her control. It all started after second miscarriage. Going through a pregnancy and having a miscarriage, that also takes a lot of toll. You are so hopeful, and suddenly it turns out to be a missed abortion or an abortion. So that also takes a lot of toll into the psyche of a woman. She also had sleep disturbances due to anxiety. And now she does regular meditation. That's what I tell my patients. They ask for dietary advice and how to manage, So my advice to all the patient is to manage their weight, come to the regular BMI, normal BMI, go for regular exercises, do meditation, try to eat healthy, try to remove all the processed food from the diet, and try to use the minimal chemicals in the day-to-day life, even cosmetic for that matter. So this is what I used to always tell all my infertility patients. She was blaming herself for the abortion, felt dejected, hopeless. She felt, yeah, she is the cause because she's not conceiving. The husband's count is normal. The husband's sperm motility was normal. The husband's side was absolutely normal, but she had a lot of issues, and she used to start blaming herself. Stressed a lot, weeping, takes things personally, can't confront people, fear of height, and reduced libido after infertility treatment, but increased desire during ovulation. That's a very physiological condition that a female may have increased desire during ovulation. So I started with a dose of syphilinum 1N. Now this drug is very dear to me in cases where there is unexplained infertility or when there is a congenital anomaly. That's a syphilitic miasm. So I started a treatment with 1 dose of syphilinum, and most of you must have guessed the remedy, pulsatilla 200. So initially, when she came to me, she was in a stage of pulsatilla. So I gave her 1 dose of syphilinum and gave pulsatilla for 4 weeks. In a subsequent follow-up, after 1 month, she reported that her PMS symptoms were better. Her acidity, which was an accompanying symptom, that was also better. So I continued pulsatilla, thinking that remedy is really working. This is after 2 months, 3 months. She complained of return of acidity. Now, by this time, she had 3 cycles, September, and then we started treatment, October, November, December. Three cycles. She was started to get frustrated. She had started getting acidity. She had started getting headaches. She had few nights of disturbed sleep, bloated feeling. She was getting angry with her husband because that's husband and wife. They were the only 2 people in the family. And where would she take out her frustration? For her husband, he was the man who was taking the brunt of her anger. Now she wanted to be left alone. Please leave me alone. I don't want sympathy. I don't want to keep telling her, she was telling her husband, keep telling me, oh, things will be fine, we'll wait. She was getting frustrated. She had started developing indifference towards her loved ones. And she said, no, I think I should go back to India and try IVF. I waited for 3 months. Her LMP was 21st of January. So I again repeated a dose of cipilinum 1M, thinking why she's not conceiving. She's ovulating. Her tube seems to be now okay. Endometriotic cyst also has been taken care of. So now anatomically she's fine. She's ovulating. Husband count is normal. Why she's not conceiving? So I again repeated a dose of cipilinum 1M, and I put her on CPR 200 because now there's a change. From a pulsatilla stage, she has become a CPR. So both are a complementary remedy. So the picture has changed in this patient. So I gave CPR to this patient in January. And after 4 weeks, other 6 weeks, she reported that she had conceived. So by just change of the remedy or possibly another repetition of cipilinum, she conceived. Her urine pregnancy test was positive, and her doctor was checking her beta HCG, that's the hormone during the pregnancy, which was 5,000, which raised to 9,000. And that's a way of knowing whether the pregnancy is doing well or not. When the level should almost become double in 2 days' time, that is a very good sign of a very healthy fetus. And later on, I kept her on Simisiviga because that's a remedy which I have found very useful in a patient with bad obstetric history. And so that really helps her through the ups and downs of the normal physiological problems during pregnancy. So she's now 10 weeks pregnant in April. Gestational sec is there. Fetal heart sounds is positive. She had minor discomforts of pregnancy like nausea, constipation from smell of food, crave sweat. Now the craving and aversion has a little bit changed with the pregnancy. Anxiety is better, sleep is good. Now because she has passed that 10-week mark, she must have had abortion between 6 to 8 weeks in the past. So after she passed that 10 weeks mark, she was little now getting confident that yes, now this pregnancy is going to be a viable pregnancy. Though that constant fear that what if always remains, but she was much calmer. Sleep was getting better. So instead of giving any other specific remedy for nausea, because I knew it was just a minor nausea and not a hyperemesis gravidarum, so I continued CPR for another 4 weeks. And she was, throughout her pregnancy, she was on homeopathy, whether she had a backache or she had acne or she had a carpal tunnel syndrome, which also comes up very, it's like a common condition that can come up during pregnancy, and that's because of the generalized fluid retention. So there is a fluid retention in the wrist, and your median nerve gets compressed, and you can get a carpal tunnel syndrome. So which was all treated with related homeopathic remedy. And she finally delivered a baby girl by cesarean section. And why cesarean section? Because she definitely has a scar and multiple scar possibly. One of myomectomy, one of septoplasty. So the best way to deliver this patient was through a cesarean section. So this is a very challenging case, and it really was very fulfilling and very I don't know, I'm not getting the right word, but just simple remedy of pulsatilla and CPR and cipilinum, and this patient conceived. So I don't think so. It's very difficult for you all to take up such difficult case. Just keep in mind your sound materia medica knowledge and picking up the cues from the patient, and you can get a success, definitely.